Alright, okay, so hello dears. So welcome again to the continuation of our lecture on HIV serology and hopefully the last, no? And for this lecture, we're going now to start Pabebe ka, girl. Start with antigen detection. Okay, so for antigen detection, of course, what we're going to test lang is P24 antigen testing. The P24 antigen, we detect it from, again, core, diba? Core of the HIV-1 virion. And the levels of this antigen in circulation correlate well with the stages or with the HIV replication or with the amount of HIV replication. As mentioned, it's high in the initial weeks of infection. And of course, it goes down once na antibodies against it. Diba? The first antibody, press the buzzer, to appear after HIV infection or to be detected, your antibody to P24. And of course, because again, na antibody, but then again, diba, progression gap po ng infection, it then rise again during the later stages of infection. And this is detected using solid phase antigen capture enzyme immunoassay. So it's still a capture enzyme immunoassay, diba? So in solid phase, ang solid phase niya is akong pagsabot ha. Okay. Solid phase immunoassay, you have antibodies to P24 na solid phase reagents na gibutang dito sa imuhang solid phase. And then imuhang sample which may contains the antigen. Okay, ako lang i-draw. So solid phase, so you have antibodies to P24, diba? So this is reagent na ni siya, so physically adsorbed. Okay? And of course, if your sample contains the P24 antigen, so i-capture siya sa antibody, and then you then add an enzyme labeled antibody, diba? So enzyme, and then you add the substrate, then they give a colored reaction, diba? Chromogenic reaction. So that's how you detect P24 antigen. Okay. Next is for viral nucleic acid testing, the last type. By the name itself, it's a quantitative measurement. So we want to determine the amount of virus present and also determine drug resistance patterns in patients. Okay? And again, also known as your viral load tests. No, I think you're familiar with that. You've heard about that, no? Viral load tests, quantitative tests for HIV nucleic acid. So in a way, it indirectly tells you the number, no, of virus present in your bloodstream or in the bloodstream of the patient. It's performed by nucleic acid amplification test to increase the number of HIV, RNA, or derivatives. So by the name itself, it uses PCR, RT-PCR, reverse transcriptase, or real-time PCR, branched chain DNA, bDNA assay, or nucleic acid sequence-based amplification, NASBA. Okay, so these are again, molecular biology. So ipapaubaya ko na yan kila Ma'am Kay and so ibang teachers sa molecular bio because I don't have the knowledge for that. Okay? Alright, kulang pa. Okay, so again, viral load tests. Again, as I mentioned, viral load tests, viral nucleic acid testing, and CD4 T cell count, usually they are used for monitoring. Okay? But they can also be used for diagnosis, but most of the time they are used for monitoring of the disease. Okay? Alright, ayan. And according to CDC, for the longest period, I think for the last years, no, early muna ilahang criteria, a positive HIV result is a repeatedly positive ELISA followed by a positive Western blot. So repeatedly positive ELISA followed by a positive Western blot test. So you have at least 2 screening tests positive and 1 confirmatory positive. Basta positive ka ni screening, mo subject yung confirmatory, which is Western blot. That is the general testing algorithm or testing procedure for HIV for the longest years, for pila ka years. Okay? Alright, so here's a picture. So that's a rapid test, diba? And an immunoassay. Okay, so positive ka, so you also subject it. If positive siya o screening, of course, subject now to Western blot. That is the general procedure, general testing that is followed for the longest years. But recently, it has now been changed, okay? The CDC now developed a new algorithm, okay? Or when you say algorithm, parang testing steps, okay? Yeah, in 2014 lang, okay. They recommended that a combination immunoassay na lang, a combination immunoassay that detects antibodies to HIV 1 and 2 as well as the HIV P24 antigen. So they're not recommending Western blot anymore. What they are recommending na is a combination na lang of immunoassays. Okay, and here is the diagram. So example, first, HIV-1-2 antigen antibody immunoassay. Example, mag-ELISA ka or rapid test. So, ni positive, so what you do is another test na po na immunoassay. ELISA, other immunoassays na itong na-mention. If positive siya HIV-1 and negative HIV-2, meaning HIV-1 antibodies are there. And whereas if HIV-1 neg, HIV-2 positive, then antibodies to HIV-2 are there. Positive siya HIV-1 and HIV-2, HIV antibodies detected. So, you don't specify. And if negative, ang HIV-1 or indeterminate, and negative po ng HIV-2, you then subject that to nucleic acid testing HIV. And if HIV-1 not nucleic acid testing positive, it's an acute HIV-1 infection. And if you have HIV-1 not negative, so it's negative for HIV-1. So, as you can see, wala na Western blot. So, ilang kitang-tang ang Western blot. Okay. All right. And if negative siya, daan pa lang, you're negative for HIV-1 and HIV-2 antibodies and the P24 antigen. So, I think what they're using here is the 4th gen ELISA. Yeah, 4th generation ELISA because these types of generation of ELISA, diba? They can both detect antibodies to HIV-1 and 2 and even the P24 antigen. So muna lahang proposed testing, or this is the testing algorithm na recommend sa CDC. Okay, the CDC. In the Philippines, we also have that. We also have what we call your RHIVDA, Rapid HIV Diagnostic Algorithm for the Philippines. This is very, very recent lang yun. Very recent. Okay, all right. Because again, HIV-1 Western blot, muna siya rational. Okay. A confirmatory test still included in the current HIV diagnostic algorithm in the Philippines is no longer recommended, as I mentioned, by your CDC and WHO because of false positive and mga indeterminate results. Okay. Early in the course of HIV infection. Because sa course of infection pa lang sa HIV, pwede siyang mag-false positive or mga indeterminate results. So, as I mentioned, diba, crucial yun ang pag-early diagnose sa imuhang HIV. Okay? And that's false positive. So, meaning, pwede, wala pa yun siya HIV pero ni positive na lang siya. So, it could be that dili siya matreat jug tarong. Okay? And especially indeterminate. Okay? Someone wala pa klaro yung result pero nandiyan siya infection. Okay? So, because of those reasons, the WHO then recommends the development of an RHIVDA or Rapid Diagnostic Testing Algorithm for the diagnosis of HIV. And your RHIVDA, it uses a combination of 2 or 3, 2 or 3 rapid test formats done in parallel or sequence on a sample that had a reactive result in the initial test. So, kaning RHIVDA, it's for confirming na, guys. Okay? So, you don't need to test na Western blot for confirmatory. What you can do na lang in this algorithm is 3 kasagunson consecutive, tested in parallel with each other, sagunson na rapid tests or mga immunoassays. Ayan. Okay. All right. So, and the key population usually kung asa siya gi-test includes men who are having sex with men, people in prisons and other closed settings, so meaning paspas na siya maka-spread, people who inject drugs, sex workers, and transgender men and women. I don't know kung sa ilang rational nga nung munilang key population. Ako rin siyang gi-copy from the AO, okay, administrative order, or from the PDF online sa DOH. Okay? Alright, so wala ko kabaloha, don't hate me. I'm not sure. Meron na po ko yung mga questions why, kani sila. Alright, but yeah, I don't know why. Okay, but muna siya naka-stipulate sa ilahang memorandum. Alright, and recently lang yun, very, very recent, AO, Administrative Order 2019-0001. Siya yung pinakaunang AO sa 2019. That is why ako na siyang gi-appeal because this is included, ako pa nang gitunan, bago lang yun sa board exam. As in, kaya basta daw mo gawas. So, very, very recent. Siya yung pinakauna na AO, Administrative Order sa 2019. Sa DOH niya siya, DOH na AO. Guidelines on the implementation of Rapid HIV Diagnostic Algorithm, RHIV-DA. Please take note na bago ra yun siya as in. Okay, 2019-0001. So, very easy lang to remember. Siya ang first AO sa 2019, di ba? So paggawas jud ani kay murag sa amohang review si Ma'am Leia Salimar like, "Uy guys, yes, ito may bagong AO whatever for rapid implementation of rapid HIV diagnostic chu. Ayan. Hindi naman lumabas sa boards. Wala ikaw sa boards, but at least, di ba? So now you know. And I think this is in full effect na, I think, in the Philippines. I've tried to connect to people, to ask people about this, like mga medicine, med students or doctors practicing already. Mas lang ni-reply pa po. So, I will update. Mag-chika pa ko. Alright, about RHIVDA. Okay, now what is this RHIVDA? So, this is the procedure. You already have a sample that's reactive. Example, nag-react na siya daan, nag-ELISA ka. Okay, let's say, nagpa-test kag HIV, and then your sample is already reactive with ELISA. Diba, generally, initially, ang old na to na criteria is after ELISA, you subject to Western blot. But this time, under this algorithm, dili na ka mag-Western blot. What you do next is, if reactive na ka, you perform the first test, which is, again, a rapid test ba or another immunoassay. Not necessarily ELISA. ELISA, Western blot. Okay, so pwedeng another ELISA na po. Or usually, rapid test ni siya. So if you're reactive, you then perform another test. Okay? So the same, rapid test ba or immunoassay. And if you're still reactive, you then perform another, third na RDT, rapid test, or immunoassay pa rin. And if you're reactive na good after the third test, you are now released, you are now considered or deemed as HIV positive. That's the algorithm. So as you can see, tulura ka sa gunson, no, consecutive na testing using rapid tests or immunoassays, other immunoassays, na wala na nag-Western blot, kay niya positive ka na, release na dahil kag HIV positive. Now, if you're non-reactive sa first RHIVDA, you're inconclusive. So, inconclusive pa yung result. And then, you repeat RHIVDA after 2 to 6 weeks kay base nimong antibodies kulang pa. And then, you also send the sample to NRL, SLH, and SACL. And the meaning of NRL, SLH, SACL, guys, is National Reference Laboratory. Nabalidain ako. Sorry, ako na ni-edit. National Reference Laboratory, San Lazaro Hospital / STD AIDS Cooperative Central Laboratory, SACL, yes. Lumalabas din sa boards, mga reference laboratories, guys. Please take note. Ayan. So that's for AIDS. Ang HIV is in SACL. San Lorenzo Hospital, STD AIDS Cooperative Central Laboratory. Yes, National Reference Laboratory. So it's a reference laboratory in the Philippines. So tanang samples to confirm if HIV positive pa siya or dili, isubmit sa SACL or sa San Lorenzo Hospital. Okay, so same ragyapon ni muhang mga outcomes if ever non-reactive ka sa each of the RHIVDA test 1. Okay? Sa imong different RHIVDA tests. So kung test 1 non-reactive, still the same. This is what you do. Sa test 2 kanipod and test 3 kani. So it's very easy, no, pas-pas lang. And I think muna siyang appeal po siya sa gi-recommend sa Philippines, no, is because para pas-pas ang pagdiagnose of HIV. Because again, we have one of the pinaka-rising, no, pas-pas, one of the most rapid rising HIV cases in the Southeast Asia or in Asia even. So it's very important. I think it's one of the rationale then, one of the reasons why this RHIVDA is established is that para paspas ang pagdiagnose ng HIV. Para ma-detect dayon, no? And para mahatagan na yun og treatment. Proper course of action after. Okay? Because again, if na Western blot, it takes time pa. It also needs expertise pa of people. Okay? Of laboratorians, of technicians. And not all laboratories, I think in routine hospitals, have Western blot in their panel of tests na ilang gina-offer. So, it would take time pag yun. Alright? So, muna siya importance then, or the significance, or the advantages of these RHIVDA. Again, that's rapid HIV diagnostic algorithm. So, very easy to understand lang, no? Instead of using Western blot again for confirmation, for confirmatory, we then use successive, okay, sunod-sunod, okay, testing in parallel, mga rapid tests or even other immunoassays. Okay, all right. So that's for the different diagnosis, no, testing. Okay, now after you are positive for HIV, no, you then of course go to counseling. This is part of it because again, dili lalim magka-HIV. Imagine, no, if you have HIV, remember that in this society that we are right now, there's still a stigma that comes with having HIV. No? And of course, discrimination and what other people say, diba? So you also need to be counseled. All right. So what does it include? Basic facts, modes of transmission, prevention, and assessment. Of course, it has to do with feelings. Sana no. May pang-counseling kay ila pang gi-take note ang feelings para sa uban dyan na mag athlete na gyud in playing feelings. Charot! Playing with feelings. Di na ko moingon sa ngalan. Charot lang. Okay, alright. Counselors must also be people who can help others express, understand, and accept their own feelings. And the patients must solve their own problems, and the counselor must give no advice. Because I think it's part of counseling that you need to let the patient understand that although he or she has this disease, it's not the end of the world. You can still live a normal life, a fruitful life, good, and that HIV is not a hindrance. Okay, so murag mo na siya mong goal as a counselor. You need to let them realize that. You don't need to give advice na murag, uy ka nang ayaw ka down or something. Murag, you have to let them realize that by their own. Parang ganun. This is what it's telling for counseling. Okay, all right. And of course, after counseling, they're also given what we call a treatment. It's known as your ART or antiretroviral therapy. By the name itself, retroviral. HIV is a retrovirus, so antiretroviral therapy. So it targets the abilities of the virus in terms of reverse transcriptase and all that. Okay. The standard is 3 drugs that's called highly active antiretroviral therapy, HAART, or combination antiretroviral therapy, or CART, that suppress HIV replication. 3 drugs are used in order to reduce the likelihood of the virus developing resistance. And because of this ART, again, as mentioned, people living with HIV can really live a normal, fruitful life and even live longer compared to the initial years that the HIV was detected, mga 1980s. Kaya usually mga 26 years ang life expectancy, if I'm not mistaken, based sa Stevens ba to? 26 years na, up to 26 lang daw ang life expectancy if you have HIV. But now that we have ART, okay, they can now live even up to 50 years or longer. But again, don't be confused or don't be complacent pa rin. Your ART is not a treatment good for HIV. It's just like, in a way, parang a support, no? A support treatment. But it's not katudyo maka-eliminate sa virus. Because although it can limit or it can decrease the number or the viral load in the bloodstream of patients, the HIV can still reside in your lymphoid organs, as mentioned. And they can continue still the deterioration of your immune system. So most of the drugs now na future drugs daw na gina-studyhan are drugs that can target that, katong naasala sa muhang lymphoid organs. Alright, but for now, we are very much thankful, good, that we have these. Thankful to all the scientists and the people behind this, good, the ART. Because again, the ART can now help. It can really prolong the life of people living with HIV. Okay, all right. And here are some examples. The partner daw is usually kaning duha. Okay. Dili. I think 2 drugs ani and plus 1 drug of any of this other types. Okay, so 2 drugs sa nucleoside analog reverse transcriptase inhibitor. So by the name itself, reverse transcriptase inhibitor. So ilang gitarget ang reverse transcriptase na enzyme. And then 1 drug of any of the following. So diba 3 drugs ang HAART or CART. Okay. And lastly, for prevention, wala nabutangan og animations. You have PrEP, pre-exposure prophylaxis. By the name itself, prophylaxis, diba? When you take prophylaxis, you take a drug, okay, to target a disease before nigawas pa ang symptoms, parang ganun. So example, if na-expose ka og meningococcemia, you take prophylaxis for that. If na-expose ka og baha, example, na naay leptospirosis risk, so you take doxycycline as a prophylaxis. So when you say prophylaxis, you take a drug to this particular disease even before nigawas pa ang symptoms. So before pa nigawas ang symptoms. That's prophylaxis. Okay. Or even after na na-expose ka, na wala pa nigawas ang symptoms, you then take this drug already. So murag nanangga na ka. Murag you're already preparing ba? Or murag you're nanangga na ka. Nanangga, sakto ba? Murag you're shielding yourself na nag-shield na ka para ana na disease. Okay. So you have 2 types for HIV of PrEP. Pre-exposure prophylaxis, meaning it's a way for people who doesn't have HIV pero ilahang ways can put them at a high risk of contracting HIV. So they take a drug known as Truvada, 2 medicines, tenofovir and emricitabine, which are medications to treat HIV, a day para mo yeah, prophylaxis, okay? Because again, they don't have HIV, but their actions, okay, their ways can put them at risk of really contracting HIV. So example, if you are a sex worker, okay, if you are polygamous, if you are promiscuous, okay, parang ganun. So you have those activities, okay, so you take PrEP, okay? And for post-exposure, if you are exposed to, example, a blood infected with HIV, and then you take that. Okay, so again, to prevent the infection. And of course, prevention condoms. Very cheap, can be seen anywhere, very affordable. And aside from protecting from HIV, it can also protect you from other STDs, gonorrhea, syphilis, and other herpes and other STDs or sexually transmitted diseases. And if you pair it with PrEP or ART, antiretroviral therapy, then it can even provide more protection. Okay, so muna siya akong chika. I've experienced this, PEP, post-exposure prophylaxis. Not PrEP ha, I'm not that active naman. Okay, alright. Yeah, I've experienced PEP because in my internship in Galyares, okay, na-prick ko. I had a needle stick injury because it was, nagkuha ko blood, yes, ETS akong gamit. And then, na-successful ang blood collection. And then, of course, diba, as mentioned, for recapping, it's always fish, diba? But ako, since Galyares, kapoy na kayo busy, daghan pang kuwaanan ng dugo. So, para mas paspas, ako siyang gigunitan. Ayan. So, do not follow. So, what I did, so of course, so, needle. So, pag ana na ako, instead, diri, nabutang siya, kanig yun, exactly this one, naana siya. Okay? Ang needle, after using na gyud sa patient. And the patient is, kanang bago lang nanganak na girl, na recovery na gyud, like, pauli na gyud siya. Like, kanya akong gikuha na blood na tests, kay pang clearance na lang ba, na murag, to check if okay na ba gyud siya para makauli. Pero okay na, healthy na gyud siya. Healthy na gyud ang patient. Kinakulban ako. So, what happened? Prick. So, ano ko sa akong self? Shucks, oh my God, na-prick to or wala? Kaya wala ko na-feel. Kaya gloves man ko, at least na-gloves ko. Wala ko yung na-feel. So, mura na siya nabadlisan ba sa needle. So, abi na akong surface ra sa gloves. Pero naka-feel ko medyo na itusok na feeling. So, what I did so of course, paspas na ko, yes, okay, thank you ma'am, pak, ko sa sampos. And then, paggawas ako sa room, kigitangtan ako ang gloves, ganun. Paglantaw na ako, nanay dugo. Gadugo na gyud siyang tanan akong finger din. So what I did giana dyan ako nakulbaan na. So, like, ako dyan gi-push na i-press ang blood. Then, ato ko sa nearest nurse station. Ako na, ma'am, hugas ko diri na siya. Sige. Then, nahugas ko diri. Nasa lang safeguard na katong liquid. Ako siyang gi-pak. Ako siyang gi-punuogan na ako ang needle injury. And then, muto siya. So, long story short, so, gi-report na ako sa medtech on duty. Kay night shift to siya na ako, guys. 16 hours di ay. Ang duty na ako sa Galyares sa una manggod, kay nakabot pa mig 16 hours. So, wala na 16 hours karon. Mo start kog 4 p.m. og duty on today, mo out kog 8 a.m. pagkaugma. So, ina na siya kakapoy. And in one shift, ikatulo or ikaupat mi mag-warding, maghuwag dugo. So, it was intense, very fun, nice to get to siya na experience. But, muto siya, so, nagduwa-duwa pa dyan if ako ba i-chika sa ako ang medtech on duty. So, ano ko na, Mark, if mamatay ka, so, wasla ka balo. So, ako ang gi-decide na mag-chika na lang dyan ko sa akong medtech on duty. And then, gi-IR, incident report, mamlera, ako ang CI ato na time. And then, pagkaugma dayon, kay since off man mi ana, mo gawas mig 8 a.m. Before ko ni uli, nihapit ko sa infection control na nurse, and then giatagan ko niya post-exposure prophylaxis, this one, PEP, for HIV lang. Kay for hepatitis B, pag-check sa akong titer sa lab, taas pa man kog antibodies to hepatitis B. So, very important yun na imuhang hepatitis B ha. Ninyo na titer, kana mga booster, do not take that for granted. Basta magreklamo na, sige kog pa-inject para sa good ni. That's it. For future purposes, kaya wakakabalo if ma-prick back or dili. So, since naramang ko, itaas mo akong antibodies for Hep B, HIV ra na prophylaxis ang gihatag na ako. And I think that was zidovudine, katong ganina. Zidovudine. Yeah, this one. Zidovudine. Okay. And so ni-take ko, I think ang zidovudine mo take ka twice a day. Alright. Okay, so zidovudine. Ayun, okay, so zidovudine, no. So, of course, I think twice a day man, I think to. So, the night dayon pagkuha na to, so off ko whole day pagkuha na ako. So, pag mata na ko, pagagabi di I drank zidovudine, usa ka capsule. Baga kayo siya na capsule dear. Sa if nakatry mo Zithromax na antibiotic, mas dako ato. Like, it's so big, like, shocks. Okay, and then, So they told me na already na ang side effects niya kay mura kang mabangag, mawingig ba, na murag malipong jud ka, intense nausea, dili ka katindog, and then and all that. So ako na shock so man ni. So murag na duty, supposed to be nagplana na i-change akong schedule, ako ang pag-duty na dapat magsigira akong afternoon akong duty kay para mo take ko gabi niya para dili na ako ma-feel ang side effects na nalipong ko and all that. So, pagkagabi ato, akong gitry. Ano ko na shock sa side effects ani. So, nitry ko one tablet. And then, pagmata na ako pagka-morning, kay ako na-feel kay init ako ang face. Like, init yun akong face. Like, init akong face. And then, naka-feel ako na medyo lipong yun siya. Pero di kaya siya inaka-intense. So, I think, ko na, tungod na ganyan sa nakatulog na ko. And then, but akong face like so hot. Like, it's really hot. And then, murag lain siya. So, ni tindog dahil ko, and then I look at the mirror, and then paglantan ako kay nihubag akong face, guys, like nihubag dyan akong face, like intense hubag, and not really intense, pero na-enlarge. So ano ko na, shocks, what is this? So mo to, dali-dalin ko ato sa lab, ano ko na, ma'am, like natudin ko sa head sa mong IS, sa immunosero, na ma'am, like what happened? Ano siya na, hala, so you're allergic to the drug. So allergic ko sa zidovudine. I'm not sure lang if zidovudine ba to. Basta PEP, post-exposure prophylaxis. So it's an ART, antiretroviral drug. So I was allergic di ay. So ni balik dahil ko sa doctor sa infection control, then ano siya na, okay sir, allergic. So ato i-stop na ning PEP, and then ilisan lang ko antihistamines for 15 days. As in like, na siya ka-intense guys. Allergic din ko sa zidovudine. If I'm not mistaken, zidovudine to siya. And then, so, long story short, wala na napadayon akong PEP, post-exposure prophylaxis. And I'm still alive naman din by now. So, thankfully, hopefully lang naman din. I think okay lang din naman. After the exposure din naman sa needle stick, I didn't feel any flu-like or IM-like symptoms din naman. So, thank God lang yun. It was really a learning experience. But it was an experience that I could share, no, to you and to future. But it's not an experience that I would let you, that I advise that you experience good or that you have. It's really as in very mind-boggling, anxiety good siya na makaambot, like murag needle stick injuries good is one of the things that you need to avoid in internship. And na-experience pag yun ako siya ko na, wow, Mark, yes, saan nagyug ka, laban lang. So, muto siya. So, the end, muto siya kong chika. So, lesson learned, no? Moral of the story, do not recap needles, or if mag-recap ka, fish out yun. Okay? Alright. Do not. Ana, lisod yung kayo, guys, promise. Do not. Okay. So, muto siya kong chika, so na-prick ko. Yes, ayan. Okay, di ba? Alright. So, that's the end also of our discussion on HIV. So, muna siya kong pinaka-end. So, ako na siyang gichika. So, as you can see, medyo, maraming tests to determine HIV. And it's a very timely, as I've mentioned a lot of times, very timely, very significant disease topic for us to discuss. Because again, it's one of the most pressing, most prevalent issues here in the Philippines. And it's definitely something that we need to discuss. And we need to address, no? And we need to educate a lot of people of kay daghang tao na wala jud kabalo sa HIV. And there have been efforts, the SUSG, yes, si Kyla, no? The Red Project, which very, very commendable. It's really good, very great initiative to create those programs for education of HIV. Okay, and it's really good. Still a long way to when it comes to HIV elimination, mangani, or to at least controlling HIV, but we're making progress, and that's important. And as medtechs, it's really our responsibility, not only medtechs even, just as plain human beings, decent human beings, to not discriminate, okay? And to not alienate people with HIV or people living with HIV. We are very much blessed, we're very much grateful that now that we are in the recent times, there have been a lot of improvements, a lot of inventions, a lot of discoveries in terms of drugs, in terms of testing, to really combat HIV. And we're very much grateful with that because people living with HIV can now live a normal, okay, and peaceful life and fruitful life like anyone else do. And they deserve that. That's their right, as anyone else has. As anyone else do. They deserve that. Okay, and we don't have There's no room in 2021, in the 21st century, for any discrimination, for any alienation, for any judgment towards these people. Okay? For the longest years, it has been coined as a homosexual disease, a gay disease, but now HIV is spreading. Not only, it does not discriminate between genders, it doesn't discriminate between ages. It can affect anyone. And again, there's no room for any discrimination or for any judgment towards these people in this time and age. Okay? Especially medtechs mo, you must know this. So medyo na strong, charot lang. Alright, but again, those are all about the serology for HIV detection or for HIV diagnosis. I hope you learned something. No, medyo sa audio ko today, kay kulang kong tulog gabi. But anyway, I hope you learned something. If you have any questions, feel free to chat me or sa atong group chat. Okay? And we're almost done again with IS. Just a remaining, makount lang ako sa akong hands, our remaining topics. And then we're over with the second semester. Asan ako padulong? But anyway, alright, ayan. So, again, thank you so much, dears, for watching. I hope you learned something. And I'll see you on the next pre-recorded lecture. Have a great day and keep safe.